Hi, this is Brian Heaberlin with Lexington ENT and Allergy, and I want to discuss the difference between a sinus infection and a cold or a viral upper respiratory infection. How do you know when you've got one versus the other, and how do you know if you need antibiotics or not? Well, duration of symptoms is one of the best differentiators between those two types of infections. So both of those viruses, viral colds and sinusitis, are going to have a lot of the same symptoms initially. So what are those symptoms? Well, facial pain and pressure, purulent or pus-like nasal drainage. You may have drainage down the back of your throat, which can cause a sore throat. You're going to have pain sometimes in your upper teeth. So you're going to not be able to breathe through your nose. Your sense of smell may be decreased. So all those things can go on with both a viral infection and a bacterial infection. Sometimes you can get some hint of whether it's one versus the other on the color of the nasal mucus, but that's really not a very good differentiator as well. So people will talk about green or pus-like, like very white nasal discharge to be more of a sign of a bacterial infection, whereas clear may give you an indication it's more of a virus. But I wouldn't put too much faith in either of those two things. The best way to tell the difference is actually the duration of symptoms. So when you have those facial pain, pressure, headache, drainage, all those symptoms, and they've been going on for more than 7, especially if it's more than 10 days, and they're not getting better or they're getting worse, then that's when it's likely a bacterial sinusitis and you would benefit from an antibiotic. So the way sinus infections develop is it often starts with a viral upper respiratory infection as the initial part, and then it kind of morphs into this bacterial overgrowth in the sinuses. So the sinuses are these air pockets that extend off of our nasal passageways, and they're lined with this respiratory epithelium, it's called, which secretes some mucus, and the mucus is produced in the sinuses. It's kind of pumped or swept out of the sinuses through these little narrow channels into the nasal passageways. And when you get a cold, those little narrow channels swell shut, and then bacteria that lives in our nose can then infect that mucus and infect the tissues and cause further swelling and further inflammation, and then it's this kind of feeds on itself, if you will, and you just get worse swelling, and then things can't drain and there's more mucus to get further infected. And so that's why antibiotics are helpful. It's more for that secondary bacterial overgrowth than it is for that initial thing. And so that's the best way to tell the difference between the two infections. And so hope that's helpful. Let us know if you have a bad sinusitis problem or you're getting chronic sinus infections. It's certainly something we treat here at Lexington ENT and Allergy. Thank you.